Before we get started, a content warning. This episode contains graphic descriptions of the aftermath of gun violence.
I am not an expert in firearms, and I don't pretend to be one, but there is a big difference when we have high-powered weapon, a weapon that goes fast. That one destroys. When it hits the liver, half of the liver is gone when you get in there.
Dr. Sam Arbabi has worked at Harborview Medical Center in Seattle since he was a resident there in 1992. Now, he's Harborview's chief of trauma, which means he oversees teams who treat victims of gunfire constantly. These days, on average, trauma staff see at least one every day.
And the pre-hospital providers that are a big part of this whole thing, they come in with the hope that we can, get the patient out of here alive. And when that doesn't happen, then I have seen what it does to the healthcare workers. People always ask, do you guys, what happens to you? And the answer is, we are all human beings. That wall goes on, and I am like a machine when somebody comes in. But after the wall comes down, then you start feeling.
Concerns growing this morning after a series of weekend shootings in Seattle, leaving 4 people dead, another 5 people wounded.
It's a rare occasion when a day goes by and this team does not treat someone who's been shot.
Reaction from local leaders on how the city can stem the tide of this year's gun violence.
This is Northwest Reports. I'm Sarah Bernard.
And I'm Maliha Sayed. Harborview is the only Level 1 trauma center in Washington state and serves as the go-to for traumatic injuries in the region, offering care to patients from as far away as Montana, Idaho, or Alaska.
It's a public hospital owned by King County and managed by the University of Washington. And it's pretty huge. The sprawling complex covers more than 2 square blocks of Seattle's First Hill neighborhood. And even if you've never been inside, it might feel familiar. The hospital featured in ABC's hit medical drama, Grey's Anatomy, is loosely based on Harborview.
Harborview sees about 50,000 ER visits every year. It's been around for nearly a century and provides all kinds of unique care, including a specialized burn center. It is the destination in our region for high-stakes emergencies.
And so it's become ground zero for some of the biggest crises of our time, including a rise in gun violence.
Gun violence is surging across the U.S.
Gun deaths in the United States hit a record high during the pandemic, and new numbers show that they continue to climb.
This is the first episode in a 3-part series about the impact of gun violence on medical professionals, the frontline workers whose job it is to respond when bullets fly.
We wanted to know more about daily reality for the people truly handling the gun violence crisis in our community. But what we also found was many health professionals aren't just handling the aftermath of this violence. They've also become de facto leaders in the effort to prevent it in the future.
Hundreds of doctors are sharing their stories under the hashtag #ThisIsOurLane.
We are the ones who not only take care of the victims of shootings, but we're also the ones who can solve it.
In parts 2 and 3, we'll dive deeper into those new efforts and what the future might hold. But first, we'll hear from 2 trauma surgeons, a nurse, and a paramedic in King County about their work and the impact it has on them.
The violence these workers see is relentless. But all of this reaction to gun violence is exactly why many feel it's time to stop it from happening in the first place.
Physicians would say, all the work I am doing and all the death that I'm seeing and all the nights that I stay awake and all the hands that I hold and all the bad message that I have to give to parents gives us the right to be part of that lane. But I would go beyond that. I would say we are part of this society. How this society functions is everyone's lane.
Nice to meet you.
Nice to meet you. Come on in.
Thank you.
Last month, I met up with Dr. Arbabi at Harborview in a conference room where physicians and nurses often meet to go over patient files.
As chief of trauma, I will give you a typical day as a trauma surgeon.
Dr. Arbabi's team usually starts work at 6:30 in the morning, beginning by taking stock of who's currently under their care including patients admitted the night before, and making plans for the day's surgeries. Every other day, he's on call for emergencies. For that, you can't really plan.
So typically you could be having your lunch at 1 minute and nothing is going on, and then the next 2 minutes you may be opening somebody's chest that is massively bleeding, there is a heart injury that you fix, or there is injury to the blood vessels inside the abdomen, or extremities that are bleeding, and you are in the middle of it with our anesthesia team, with our blood services, and the whole entire team. You're working to save patients' life.
Since he's been in trauma-related medicine for decades, I asked Dr. Arbabi if he remembered the very first time he treated a victim of gun violence.
The first time actually goes to when I was a medical student at University of California. And at that time, I have to admit that I was so focused on taking care of the patient and so scared as a medical student. The person was very similar in my age that I wasn't thinking about anything else. The person, in addition to have a gunshot wound to the abdomen, had a gunshot wound to the leg, and my job was to dress that leg and make it stop bleeding because the patient was really bleeding from the abdomen, and others were going to take care of it. I still remember, though, that it's whenever you have somebody that is very close to your age and you see the injury, it does affect you, but at that time, I wasn't thinking about any of this. I was just thinking of, I am gonna do the best job possible, and that leg is not gonna bleed.
And since then, you've treated many victims of gun violence.
Unfortunately. There could be a few days that you don't see one, and then suddenly you see an uptake of multiple coming in. I've been living in Seattle for a long time, and Puget Sound, and I would say that over the past 5 years, especially after COVID, I would say that there is significant increase in gun violence that we are seeing here. And we are seeing that increase in mostly adolescent or young men. And that is quite sad because it's quite difficult to take care of a 17-year-old that may not survive.
The trend when it comes to shootings in King County, it is alarming.
It's true that according to almost every data set out there, the pandemic coincided with the sharp increase in gun violence in our region and across the country. According to the Centers for Disease Control and Prevention, more Americans died of firearm injuries in 2021 than any other year on record. Gun deaths in Washington state have risen more than 40% in the last decade. And in King County, in 2024, gunfire killed record numbers of children and teenagers.
We're seeing more kids being shot and killed this year than last year.
It's not surprising that this takes a huge toll on healthcare workers. But it can be hard to do the job if you think too much about the bigger picture.
So we teach people, and this is part of it, is that during the time that you're managing the patient, take a deep breath and put all your emotions, draw a wall around all that emotion. All of that emotion is going to be walled off until that patient is taken care of. It doesn't help people to break down in the middle and start thinking that this is somebody's child, that this is somebody's significant other, this is somebody's family or friend, because it's difficult to think that way. The first thing you think about is your education and all the things that you've learned, and you start taking care of the patient with the best you can, and the you wall off that emotion. And you have to wall it off until the last patient is taken care of, because there may be another patient after that one. I can tell you there was a recent patient, and that patient, the entire team worked on this patient. At the end, the patient died. We go over all the deaths to make sure that we did the best we can. And we have what we call morbidity and mortality. It's a conference that we sit down with all the people involved and all the people who were not involved, the experts listening to what happened. And we go over it like a fine-tooth comb, and we find out if there was something we could have done better. So everybody's candid, everybody's open. And I can tell you that in this case, they did everything perfect. But both the two residents that were involved, when they were describing it, they couldn't stop crying. They were sometimes difficult. And you could see it because this person was very young. And especially if you have, if that person is reminds you of your own kid, makes a big difference. Shouldn't, but it does. As a human being, you see it. And all of them, I am now at the age that I see many of them as my own kids. And when I see them, it becomes really sad because they're all young. I know what people see in the movies, it's not like that. People are scared when they're shot. They have that fear in their eyes. They don't know what's gonna happen. You can see it. The brave thing that you see in the movies that is not real. It all of us. It is one's life, and the fear comes in, and they just look at you like, just save me.
The worst part for many healthcare workers is losing a life on the operating table, especially a young person. But Dr. Arbabi says, even when people do survive, which is a lot of the time, they have a long journey ahead.
Again, it's not like movies. In the movies, you either make it or you don't. And the first thing they do in the movies is they go after the bullet to take it out. We almost never take the bullet out. The bullet has already done the damage. And if it's inside the body in a location, if I try to take it out, I may do even more damage taking it out. The reality is that when they make it, it takes many, many days of intensive care unit, rehabilitation. The muscle is atrophied. It will take a long time for them to recover. So yes, many at Harborview Medical Center, we are one of the best, and our rate of recovery is the best based on what I can see on what we call Trauma Quality Improvement Project, is one of the best in the country. But when they go out, they have a long road ahead of them. And it's not like, they come out beautifully with the makeup on and they say hello to the universe. In addition to all the physical scars that they have to deal with, there is the emotional scar. I told you there is a lot of fear when they come in, and that fear, all the treatment we did, part of the treatment is not without pain, it's painful. So yes, many make it, but it's not panacea. It takes a long road, and it takes a functioning society with ability to rehab and resources to rehab all these patients. They had the gunshot wound, but we don't want them to come back with another, which is actually not unusual. To me, when I see all this gun violence, sometimes I'm just like, was there not another way?
My name is Katie. I work on the trauma surgical ICU as both a staff nurse and then as a charge nurse. So I do direct patient care and then teaching and assisting nurses as they are also doing direct patient care. So kind of two roles.
Katie Black also works at Harborview. She's been a nurse for many years, specifically in trauma-intensive care. I caught up with Katie over Zoom. We tried meeting up in person, but scheduling was tough, which was the case for most of the people we spoke to for this series. It's sometimes hard to predict your schedule when you're grappling with life and death situations, or at least life-altering situations, on a daily basis.
Over the years, have you found yourself treating a lot of gun violence victims?
I would say in the world of trauma, it's pretty normative. When I first moved to Seattle, it was very rare. I've been at the hospital for about 8 years. When I got here at the beginning, the most common injuries were from car accidents, were from mountain-related accidents. We got a ton of industrial accidents from Montana and Alaska, but there wasn't kind of this spike of gun-related violence that it feels like now.
These feelings are backed up by numbers, not only region-wide, as we've mentioned, but also specifically at Harborview. In 2017, 18, and 19, this one hospital saw an average of 330 gunshot wound patients per year. By 2022, that number was nearly 530.
Like it was a few weeks ago where we had multiple people who were on our unit for gun-related injuries. It can change someone's whole hospital course, like in millimeters, which way the bullet went through the body. And so sometimes if people are on our unit, that means that it did quite a bit of damage to their body and they're requiring quite a bit of support while kind of the healing process happens.
Katie says one recent patient comes to mind.
We had a patient who had been in like wrong place, wrong time. Someone who was like with their boyfriend 2 years ago was shot, had kind of this pretty devastating injury, healed from that, and then was shot a second time and kind of wrong place, wrong time 2 years later and was on the unit. And it was a more devastating injury this time.
The patient, in other words, was somehow caught in the crossfire of a shooting in Seattle. Not once, but twice.
And that, I think that kind of wrong place, it feels very out of place for Seattle. That doesn't happen very often. And the conversation on the unit was kind of, when this happened, was kind of signaling maybe a shift that is happening, whether temporarily or long-term with parts of Seattle. But walking her parents through, it was really hard and challenging and impossible, because how do you live through two never events?
In your role, do you find yourself speaking with families a lot and working with families of patients?
Yes, I would say that's kind of one of our primary jobs, in addition to caring for the patient, is providing care for the family that's present and kind of being their partner in kind of the journey of being in trauma and understanding what's going on with the body, but the physical body, but then also kind of talking about and holding space for the process of trauma, like psychologically, that's happening as well.
Katie says how these difficult conversations go can depend on the nature of the injury. Sometimes it means talking about a new, severe disability.
Especially if we're thinking like a gunshot wound to the head, is this something that is survivable, like mentally survivable? Is their brain going to regain function? So kind of there's a lot of those difficult conversations around prognosis.
Sometimes it means talking about justice.
I think it's such a human nature when someone has had violence inflicted on them by another person to kind of want to, there's a justice part to it where people are like, this person who did this to them, like, we want that to be handled. With this particular person who had two injuries, it was a lot of parental grief around, like, how could this happen if we did everything right? There's no fault that they could latch onto, just was really raw. There's no one to blame. There's no one to kind of like focus on to say the police are bringing them to justice. It was truly just a random stray bullet from something that I think sitting in that with the family was just really, the conversation came back to like, how is this so freely available and allowed, like in the country, that this is a possibility?
So do you want to start and go ahead and just like introduce yourself, your name, your title, what you do for King County?
Sure. My name is Paul Nordinger, and I'm a medical services officer for King County Medic 1. That is, I am the on-duty supervisor for all of the trucks in service for that day.
Paul Nordinger is a paramedic, And as Medical Services Officer, or MSO for short, he supervises other paramedics and takes care of all kinds of administrative tasks. If there's a major incident, for example, such as an incident of gun violence, he's in charge of all of the medical resources that are needed for that.
So that's pretty much, it's busy. It keeps me busy.
Like with Katie, I also caught up with Paul on Zoom. Because yeah, he's that busy. But we were curious to hear from him, to learn about what it's like to be the very first responder. Paul and his team have a strong relationship to Harborview, too. Every patient they see who requires major trauma care gets sent to Harborview. And Harborview, in fact, was instrumental in the creation of King County Medic One over 50 years ago, when it was one of the first paramedic programs in the country. Paul's career doesn't go that far back, of course, but he's been around a while.
I've been a paramedic for 27 years. I started my career out at Medic One. I went through training in 96 and have been there ever since. The self-satisfaction of taking care of sick people, I think, is what keeps me going. Most of the time when we intervene in somebody's crisis, we really do make a difference.
Just like everyone else we talked to, Paul says he's also seen a sharp increase in gunshot injuries in recent years. It's very noticeable and becoming overwhelming.
When I first started, we had gun violence, but it was seldom, right? It was once or twice a week, maybe 3 times a week. You would either go on one or you would hear of an incident. And now it's not uncommon for us to get called to more than one in a day.
For some context, in 2023, there were 861 firearm injuries treated by emergency medical services in King County. So more than one in a day sounds about right.
You know, to be honest, it takes a toll on you. It takes a toll on you mentally and physically. I think the biggest thing is the mental drain, because as this continues on, one of the other big changes that I've seen is we're seeing a lot more younger population involved in this, you know, from adolescents to young teens to preteens to you know, young adults, and that really takes a toll on your mental well-being, is to seeing these very, very young people who have been involved in these incidents.
Paul and his team are often the first people meeting the families of these victims on the street. They have the same kinds of impossible conversations Katie and her team are having with families later in the hospital, but when people are often in shock and there's even less information to share.
To deal with families that have just been through this catastrophic event, and you know, they try to make sense of it. Well, you can't make sense of it at the time, so you do the best you can. You know, they want absolute answers on outcomes that we can't give them. So trying to give them as much information as we can. And the other part is they're angry, right? And that anger is sometimes deflected towards us. We don't take it personal, right? I don't take it personal when somebody's mad. I don't take it personal when a crowd member is mad, because all they want is they want information with, unfortunately, I can't give them, or I have to be the bearer of very bad news that unfortunately somebody didn't survive their event. And that really is difficult. We've had some incidents here in the county where there's been multiple patients, and those are the toughest ones to deal with. We've had as many as 9 in one event. We've had 5 in another event. Those are the ones that stick out. They all stick out, right? I can drive down the road at any time and go, yeah, I was on one there, I was on one there. But it's the multiple ones that probably stick out the most.
In part because of all of those incidents that stick out and the emotional and psychological toll it does take. Paul is also a member of what's called the Medic One Peer Support Team.
So it started probably 4 or 5 years ago. There was studies being done in the first responder setting of mental health wellness. And back when I started, it wasn't even a thought. right? You just went out, you did your job. Unfortunately, people didn't care how you felt or anything like that. But as time grew on, people who are a lot smarter than I am figured that, you know what, there's some things we can do here to help the first responders out.
So they started a peer support group.
If somebody has a difficult call or has a difficult time at work, we can put them in touch with somebody, and somebody that they have things in common with. And that could be a phone call. That could be somebody driving to the station and pulling them aside with a cup of coffee and saying, hey, heard you had a bad call. You want to talk about it? Or how you doing? Checking in with them. I think it helps the employee know that, hey, somebody does care that I just had one of the worst calls of my entire life. And then I have to turn around and put a smile on my face and go back to work. And then the other part is that peer support person can kind of look at him and go, you know what, maybe my friend needs a little bit more than this. And we can help with that too.
In other words, there are easier ways now for paramedics to support one another and to find connections to other kinds of mental health support.
All first responders, back when I first started, you put it in a vault in the back of your brain, you turn the key, you lock it up, and you try never to remember it again. Ain't gonna happen, right? It's always gonna come. I've seen way too much young death in my career. I can't give you a specific one just because there's just so many. I have talked over the past 5 years when we do this. I talk routinely with people about it as opposed to before, when if you talk to somebody, you were maybe considered a little weak and maybe you should find another job. And that's when you took the lock and the key. Now routinely talk with people and it's much better.
And among the things Paul and his colleagues talk to each other about are those hard conversations they have to have with families of the victims of gun violence.
I've done it more than I want to ever again. If I don't have to do it again, that would be perfect. If I had never have to run another assault with weapons response, that would be perfect.
I think some of the things that are really heart-wrenching are seeing people who are injured over and over again, So while we operated on this patient a year ago for a similar type of injury, and every time you have to operate on somebody who's been operated on before, it's even harder.
That's Dr. Eileen Buer, Chief of Surgery at Harborview. I met up with her last month in the same conference room where I spoke with Dr. Arbabi. Both surgeons are integral to Harborview's trauma response.
So my name is Eileen Buer, and I'm a trauma surgeon by training, and I've worked at Harborview for over 30 years now. I am currently serving as the chief of surgery for the hospital.
Dr. Buer says there's no such thing as a typical day, except maybe to expect the unexpected. But gun violence has been part of this work for as long as she can remember.
I actually started my career in medicine as a paramedic. I was working in Maryland. I do remember as a paramedic caring for many patients with gunshot wounds. And that was my first exposure to gun violence was in that setting as a very young person. So it was pretty eye-opening. I think as a surgeon, I've certainly had many that stand out in my mind. I think the ones that are hardest are the children. And we, as the pediatric level 1 trauma center as well, see all ages of people impacted by gun violence.
Like most everyone we spoke with for the series, Dr. Buer says she's also seen a sharp increase recently in the number of patients coming in with gunshot wounds.
Yeah, so I think, unfortunately, we've seen a pretty steady uptick, and the most dramatic increase we've seen is during the course of the pandemic and following it. So, I don't know if, lots of societal factors around those challenges associated with the pandemic, but it doesn't seem to have slowed down. There are challenges whenever society is stressed, when people are out of work. A lot of violence is associated with crime, which is associated with poverty, and challenges, that people face in that environment, just trying to live day to day. I think certainly there was some concern that domestic violence was a challenge with more people stay at home and things like that. But I don't think we really know exactly what caused that epidemiology change. But it wasn't just here, it was around the country.
A lot of the data that people point to when it comes to gun violence involves the number of deaths. But Dr. Bulger echoes her colleagues in pointing out that gunshot survivors suffer too.
I can see many kids in my mind who had a gunshot wound through the spinal cord, for example, and so they're paralyzed, And that's just a completely life-changing event for somebody who's a young individual. So
a few years ago, Dr. Bulger was part of a team of colleagues that decided enough was enough, and it was time for someone at Harborview to try to do something about the root causes of a lot of this violence.
Our system is designed to take really good care of really sick patients, and we have a great team to do that. But we would much rather not have you injured in the first place. And so we spend a lot of time thinking about injury prevention and what strategies we can do to reduce the rates of injury. I'd be fine putting myself out of business, honestly.
All the people we talked to, that's what we heard again and again. Healthcare professionals, whose job it is to respond to gun violence day in and day out, want to prevent it from happening.
Gun violence can be prevented. When you have an increase in this, when you see it, and when you see it in a younger group, you start thinking that this is something I need to do something about. There are very few trauma surgeons who don't think that way.
A lot of our providers have informed the motor vehicle industry as far as car safety standards to see what's actually helpful. So there has always been a role and a place for, we're seeing the impact of trauma. Now, how can we prevent it? And in my mind, this is just another piece of that.
So what we've tried to advocate for is let's take it out of the political realm. Let's talk about it as a public health problem.
So gun violence as a public health issue, from the perspective of healthcare workers, that's a no-brainer. And of course, it's not new either. Dr. Bulger and many others have been describing gun violence as a kind of epidemic and advocating for policies that could reduce gun injuries and deaths for a very long time. Yet, arguably, it's only been in recent years that those efforts have really started to gain momentum.
We're going to begin this hour with the U.S. Surgeon General as he declares this morning that gun violence is a public health crisis in America.
Gun violence is a public health crisis in our country that requires a public health solution.
Despite how incredible our trauma center may be, the best medical treatment is often prevention.
And it's only in the last 3 years that these ideas have taken shape at Harborview. We'll introduce you to the trauma surgeon who helped create a program designed to interrupt the cycle of interpersonal gun violence, all starting at the hospital itself.
Taking care of their injury and getting them out of the hospital is great, right? We want them to be alive, but we also want them to thrive and be healthy and grow and be safe.
That's next week on Northwest Reports. Thanks for listening to First Response by Northwest Reports. We'll be releasing 2 more episodes in this series, with the next one publishing on October 2nd. This episode was reported and produced by me, Sarah Bernard, and Maliha Syed. The story editor was Ryan Famuliner. Our executive producer is Sarah Menzies. You can subscribe to Northwest Reports wherever you listen, and whatever platform you're listening on, please review us. We'd love to know what you think of the show. Also, if you'd like to support the work we do at Cascade PBS, whether it's our lineup of podcasts, the video docuseries we stream every week, or the in-depth reporting we deliver every day, go to cascadepbs.org/membership. In addition to supporting our journalism, members receive complete access to the on-demand programming of Cascade PBS. For the latest political, environmental, and culture news from the Pacific Northwest, visit cascadepbs.org. That's also where you'll find First Response. Northwest Reports is a product of Cascade PBS. I'm Sarah Bernard. We'll be back soon with another episode.